Kick back, relax, grab your favorite snack because News 9 is here with your weekend dose of entertainment. It's time to take a deeper dive into the buzzworthy happenings of the entertainment world. From celebrity gossips to exclusive conversations, from nostalgic moments to News 9's pick of the week, don't worry, we've got you covered here. And I hope you've grabbed your popcorn by now because News 9's page 3 is here to serve you everything that we call entertainment. So do stay tuned every Saturday and Sunday, 2:30 p.m.
Being a chef, it's my priority to deliver taste in a plate with good presentation, unique innovation. You need to explore, you need to experiment.
You observe the people, make them happy, make them feel happy, and in the end you are smiling. That's the most important thing.
This is India's #1 news network, and you're watching News 9, English news as it should be.
Thanks very much for tuning in to News 9. You're watching Unmissable. I'm Nabila Jamal. As always, I take you through news from India and across the globe. We're going to start with our top stories. Of course, on Deep Dive tonight, we will delve into one boy in Delhi-NCR region who had to literally get his tonsils removed, and the parents of that boy blame Delhi pollution for this severe crisis. And we're looking at pollution crisis rising. Delhi, though, because the pollution levels have dropped from severe to poor, have now lifted GRAP 3 restrictions. Bombay, on the other hand, have implemented GRAP 4. What's the reason to why we're not unable to, consecutive governments, unable to crack down heavily on pollution? Why should people really be bearing the brunt to such an extent where they have to surgically get their tonsils removed? We're going to take you through that tragic story on top of our list, and also delving deep into our deep dive segment is HIV AIDS that's now on the rise among specific groups. We hear that on today's World AIDS Day, and on a day like this, numbers are important, and we see in Karnataka there are growing number of HIV cases among the LGBT community. We will take you through those details with our doctor and our activists on board. And finally, our top story on day tonight, we take you through details on extensively speaking on the SIR, the Parliament at this point that's now triggered into a debate with SIR being discussed extensively. We will give you those details, and also cyber spoofing. We hear that there was spoofing that was done with airport authorities are hustling to try and fix all that mess that was created due to system failure a few weeks ago. Cyber spoofing has now been proven by the government. We're going to take you through details. Let's start, as always, with the headlines. The centre directs smartphone manufacturers to preload the government's Sanchar Sathi cyber safety app on all new devices within 90 days and ensure it cannot be uninstalled as part of efforts to curb phone fraud. A first-year student of the Kalinga Institute of Industrial Technology University in Bhubaneswar was found dead in his hostel room, the third such incident this year. The deceased has been identified as Rahul Yadav, a resident of Raigad in Chhattisgarh, who was studying computer science engineering in the private institute. Kolkata women allege assault and molestation in a moving car. Police have registered a case, one accused known to the survivor, while the other two remain unidentified. Kolkata already at this point looking at several cases of crime against women, and here's another attempt to rape in a moving car that's been reported from Kolkata. Activist who's based in Kerala, Rahul Ishwar, has been sent to 14-day judicial custody in a case related to online defamation of a woman complainant in a sexual assault case involving suspended Congress MLA Rahul Mamkuttatil. Allegations are that he named the identity of the survivor. Now, he says this is a politically motivated arrest. Death toll in Hong Kong fire now climbs to 151. Residential building fire, unfortunately, has been the worst for Hong Kong in their history. 151 deaths that's been reported in that fire. The police say that there are at least 40 people who are still missing. A shocking incident has unfolded at a zoo in northeastern Brazil, where a 19-year-old man was mauled to death after he broke into a lion's enclosure inside a zoo. Bangladesh court sentenced Sheikh Hasina to 5-year jail term in a land scam case and imposes 1 lakh taka fine. Remember, Sheikh Hasina already gets lifetime imprisonment from courts in Bangladesh for crimes against humanity, claiming that she, while in her tenure, ordered for mass attacks or police excesses against the youth, while several of them had died. She faces life imprisonment in court. Here's yet another case now on Sheikh Hasina, where she gets 5-year jail term in a land scam, a separate case. SpaceX CEO Elon Musk said that his partner Shivon Zilis is half Indian and one of their children's name is Shekhar, after the Nobel laureate Subramaniam Chandrasekhar. So a big link there that Elon Musk reveals of his Indian connection. Samantha Ruth Prabhu, Tamil superstar, ties the knot with filmmaker Raj Nidimoro in a private ceremony at the Ling Bhairavi temple inside Isha Yoga Center. They both worked together in a film and he was her director. It seems like the two have finally decided to tie the knot, formalize it. All right, let's start with our top story tonight. A shocking story that's really left all of us stunned. If you're in Delhi-NCR region, that this will surely disturb you. A 5-year-old boy in Noida had to undergo tonsil and adenoid surgery just to breathe. His parents, Sakshi and Sachin, say that Delhi-NCR's polluted air is all to blame. The reason to why he was forced to surgically remove his tonsils is because he was breathing polluted air. The boy's parents now blaming Delhi pollution for this struggle. In fact, the boy we hear struggled extensively with allergies, with blocked nose, breathing trouble. Doctors told them that a surgery was the only way out. And it seems like, according to the parents, Delhi pollution worsened the situation for him to such an extent where this was only the last resort. A child needing surgery because of the air around him isn't clean. Now, remember, this isn't rare anymore. Delhi is looking at many such cases that's now coming to light. Delhi-NCR has been stuck in the very poor to severe category of air pollution. This zone of 300 to 400, much more sometimes. But instead of, in fact, tightening the controls here, the Commission for Air Quality Management has decided to lift GRAP 3 restrictions in the city. In fact, according the decision was made because they believe, the pollution control authorities and the government believes, that severe category, now Delhi pollution is still better than what it was a few weeks ago when it was severe category, that was in the 400 range. Pollution has now dropped to the very poor category, which is in 300 range. So therefore, the severe GRAP 3 restrictions need not be in place, which means non-essential construction, etc., that was curbed has now been lifted. Now, this has also led to a lot of outrage because people in Delhi say that this very poor to severe category pollution difference is really not much. It's still very bad. It's hazardous, as we see here clearly, for people to breathe. Severe measures that are meant for emergency situations are still not being used. The question is why. Now, remember, Mumbai, on the other hand, which is a city that once had better air than Delhi, today also is looking at high pollution levels. And Mumbai was quick enough to impose GRAP 4 restrictions, a very severe category restriction that's imposed in Mumbai right now. Mumbai's air quality at this point is hovering between 200 to 300, which is also dangerous. The difference is that Mumbai has decided to impose GRAP 4 in multiple areas. Construction in Mumbai has stopped, dust, heavy work, all halted. Polluting units have been shut down in Mumbai. Over 50 construction sites have been given notices as well. But meanwhile, hospitals are reporting a rise in breathing problems, especially among kids. Allergies, sinus issues, asthma, all going up. This is no longer about pollution levels on a screen. This is about children who are being pushed to hospitals and even operation theatres, with this classic example coming from Noida. Tragic situation there. I would like to go into our guests who are joining us for a little more insights into how severe this could be for a boy to undergo a tonsil surgery, the family blaming pollution levels in Delhi. Could there be a connection? Let's start with Sanjeev Bagai, Dr. Sanjeev Bagai, Nephron Clinic, who gives us a little sense of what this story is all about. Dr. Sanjeev Bagai, if you could please take it away for us. The boy needed surgery to remove his tonsils. Family members say pollution is the reason. Could there be an absolute connect between the two?
Good evening. I think this is a truly a catastrophic situation, not only in Delhi-NCR, but in many other places, pan-India, especially in northern India. Now, when you talk in terms of AQI, very often we pick up one particular line item, which we call as particulate matter 2.5. But let me remind the viewers that that's just one amongst the many co-pollutants, and the others are equally harmful, if not more, which includes carcinogens, volatile gases, methane, benzene. They contain heavy metals, particulate matter of micro nano plastics. They all cause body damage in organs inside acute phase, mid phase, and long-term phase. With regards to this child, it's important to understand that children are more vulnerable than adults because the immune system and the respiratory system is not fully matured and developed as adults. Point number two is that kids' respiratory rate is 2 times faster than adults. Therefore, they breathe in twice more pollutants every minute as compared to adults. Also, children are exposed in the early morning hours going to school, where the relative humidity is high, and they tend to inhale a lot more at the densest part of relative humidity and the severe cold, which enhances the AQI towards the real hazardous category. There are also reports to show that there is a 20% underreporting because of the hygroscopic nature of aggregation of the particles. So the particulate matter is actually a lot more than what is counted. We know that these things cause acute respiratory problems, including wheezing, asthma, bronchitis, even up to 29% increase incidence, tonsillitis, throat infections, ear infections, and so on. Just focusing on the respiratory part, in the case of continuous exposure of this nature, chronic infection sets in, the tonsils and adenoids can get definitely enlarged and inflamed, and the breathing difficulty sets in, especially in smaller children. And really, when you're left with no option, routinely, we don't do tonsillectomy, but when we're left with no option, we have to subject a child to this surgical procedure. These are largely avoidable conditions. The way we are looking at GRAP 3 to GRAP 4 is skewed. We need to revise our criteria for GRAP. That means any AQI more than 150 at least, or going up to 200, there should be restrictions. There is no compliance with regards to the builders and real developers. There is no compliance of controlling the road dust or the emissions. There is no digital control of traffic. There is no control on the emissions which are coming from the pollutant industries and the thermal plants, and of course the Parali fire farm burning in Haryana and Punjab. We need a very, very strict action plan, not for this season. This season we are already ruined. But for the coming years, we need a strict plan with deliverables as results, and we can achieve it, provided most of the governments in the nearing states, that's Haryana, Punjab, Uttar Pradesh, Delhi, and others, sit together, have a separate task force which involves doctors, scientists, environmentalists, who can actually guide the way forward. We need a law which is strict. We need implementation which is swift, and punish the people who are polluting the environment.
Right. Right. Let's also bring in our guests who are with us at this point, or air pollution experts. Dr. Gufran Beg, Chairperson NIS and founder of Project Director Safar. Dr. Gufran, here we're looking at Mumbai. We hear imposing GRAP 4. In the latest information that I have, my team has just sent me some information that Mumbai has now lifted GRAP 4, but they put it briefly until pollution levels were curbed. So all non-essential construction was stopped. Polluting vehicles strictly were filtered. The restrictions were quite harsh, and Mumbai has done it despite being a coastal area where ideally pollution would move past quicker. Delhi is landlocked. It's a place where we've been suffering for nearly 2 decades. I don't expect anybody to come and wave a magic wand, but something should have been done so far. Why have the Delhi government and the Pollution Control Board lifted GRAP 3?
See, I think we need a complete overhaul of the guidelines, which there are a lot of loopholes which is keeping a public as the government all in a very different platform. For example, as you mentioned already, that as per the GRAP, whatever it has been listed out, it is true that GRAP 4 comes when it becomes a severe plus. Yani ki, for example, AQI has to go 400 plus. But so whatever Delhi ACAQM is doing, they are doing as per the guidelines what we are having. But the problem is that for that you need to have a correct air quality index, for which these guidelines are made of. And we do not know still that the geographical coverage of the stations which are made, whether they are providing AQI as a very poor, which is supposed to be severe, or other way around, because 4 or 5 stations getting into highly greener zone, averaging out all the toxicity of that particular thing. So, that happens. Mumbai, this problem is one much more severe. Now, this is very good. In fact, I personally feel very happy that when the GRAP 4 or GRAP 3 has been imposed in that one, basically last time judiciary has told about this particular thing, and then it has happened. But then the point here is that GRAP guidelines is not different what is there in Mumbai or something. Only GRAP guidelines exist in Delhi-NCR region, all those, and then people are doing this. So under that, whatever the readings you are seeing, based on that, it should not have been. It is very good step that GRAP 4 has gone into that. But I will add one more point here is that the kind of a air quality index which is being shown and what is visible in Mumbai is a huge amount of discrepancies, and there is a lot of confusion with the people. And that is the reason that in my op-ed I have mentioned this thing that the stations which should be in a different micro environment should be an average of that, should be the realistic air quality index. There are some areas like Devnar or those are showing very poor and severe air quality, whereas some areas which is showing only the good, average becomes moderate or poor. You were asking something.
Dr. Gurfan, my limited question here is why is policy only focused around emergency restrictions rather than a little long-term preventive measure? GRAP 3 being lifted so quickly, it was implemented and lifted also very quickly. What's the difference also between severe and very poor? There is a marginal difference, but for us while breathing, there's really no difference. It's as bad.
Obviously, but then the guidelines, that is why I told that guidelines need to be updated. It need to be come very close to the reality. But then the solution wise, I will tell you that there are 2 measures, long-term measures has to come. There is a long-term planning has to happen. But then even in the emergency response which is happening, there also I disagree with that, because so far even the CAQM is putting a restriction in Delhi capital territory. There should be airshed approach. So unless you do all those restrictions, all those guidelines implemented in a true sense in complete airshed, which involves some of the parts of surrounding 6 more states, then only you will see the difference. That is why you are not seeing. First point. Second point is that this sprinkling of water and all, that will give you that will decrease the PM10, bigger particles. Our major problem with the health wise and everything wise is a smaller particle, PM2.5, even less than that. They are much more harmful. Everybody we talk about it, but then in CPCB, the guideline says all those 20%, 30%, 40% reduction measuring scale is PM10, not PM2.5. And that is where the problem is that 20 to 25%, not more than 20% is a contribution of the dust which you are dealing. So you are basically targeting PM10, not PM2.5 properly. So the source for PM2.5 measure is a transport sector, diesel, petrol, heavy duty vehicle coming within the city as well as surrounding region in a airshed. So in a short term also, the measure should cover airshed, otherwise this will be exercise in futile.
Yeah. You know, before I come to Professor Soumitra Mukherjee, who is the director of NEER, also joining us, a quick one from our Dr. Sanjeev Bagai. Sir, do you believe that these complications are lifelong? From what I see here, once it starts off, it takes a long time for children, especially if they're they're diagnosed with sinusitis or asthma. We hear now even arthritis being linked to pollution. Is this basically long-term damage that will take many, many years for it to fix, or even not, maybe?
This is really the crux of the problem. The true picture is that it is going to affect not this generation but many generations. So you're looking at decades of damage in subsequent generations. The reason is, even 1 year preconception, that means before a young girl gets pregnant and she's exposed to this kind of pollutant, 1 year before she conceives, the damage already has set in. The babies which are growing as fetuses, as an unborn fetus, is having DNA damage. That means your chromosomes are being harmed because of recurrent breakages. We're seeing more number of genetic disorders, more number of cancers, more number of fixed cardiorespiratory problems, structural abnormalities in children, which includes kidneys, congenital heart defects, congenital limb defects, and so on. So it is extremely important that we focus on controlling this as a strict measure. We know that every 22 units of AQI increase is equivalent to smoking 1 cigarette. That means when your AQI is in the range of 500, 600, 700, and sometimes even more, in a period of 5 months, a Delhiite is smoking 8,000 to 9,000 cigarettes per season. If that is not going to kill you, I don't know what is going to kill you. We are now causing damage to the next generation, in which children are going to be born with defects. Young children are going to grow up with congenital abnormalities. We are seeing increase in cancers. We are seeing increase in lung disease, brain disease, leukemia, hemoglobin going down, stunted growth of children and adolescents. So overall, in a picture of the next few decades, we'll see a sicker, stunted, and neurologically damaged population. We are losing 7 lakh crores per year in trying to treat the damage because of pollution. I can bet my last buck it is cheaper to curb the pollution than to treat the complications. Over to you.
Yeah. Now, you know, this is heart-wrenching to see a family really, you know, at this point struggle with your son, who is so young and has to basically surgically remove his tonsillitis, and they're directly blaming Delhi's pollution levels. Imagine if a child like that, ideally supposed to be healthy, has to be operated upon because of such severe pollution. I can only wonder what the plight of many senior citizens are in the Delhi-NCR region. You know, Professor Soumitra also joins us. Ms. Soumitra, pollution levels is, you know, above. Right now, we're drowning in pollution in Delhi. Would you be able to tell us if the reason to why Delhi has decided to lift GRAP 3 while places like Mumbai are enforcing stricter rules like GRAP 4? Tell us a little more on what's stopping the Delhi government or the pollution authorities to enforce these rules more effectively. You know, they're doing, brief measures they implement and then they withdraw, they're doing it, they're toggling between a few weeks. Shouldn't there be more consistent measures instead of doing it in spurts?
See that first of all, you have to see the crux of the problem. The problem is that there are definitely PM 2.5 and PM 10. These are the particle and particulate materials which are in the air. And every year, everyone knows that it will happen. But even though there is no precautionary measures are taken in advance. So the main culprit is the moisture in the atmosphere as well as the moisture in the soil. And at the same time, when we are talking about that emission of the vehicular emission, but at the same time, we should think about the friction of the tire. You see, the friction of the tire, it also generates lots of particle and particulate materials. So the condition of the tire also needed to be monitored. And at the same time, the moisture content of the soil, the ground, as well as in the air. See, there are lots of modern techniques which are available, like SMOS satellite, by which we can measure the soil moisture as well as the atmospheric moisture content by using the microwave sensor. So in advance, it has to be done, and it is doable. There are lots of scientific manpower is available in our country who can do, even ISRO can also monitor these things. And at the same time, there are different state level scientific organizations. They should be empowered to do all this monitoring in advance. So then we all are very fond of telling about the problem, but there should be some solution. There is two solutions, that one is short term and another is long term. Short term immediate solution is the spreading the water, sprinkler. So artificial rain was failed, it was not successful. Then there should be some device through which the atmosphere should be in a state of sufficient moisture. Then only that the ground also should be sufficiently wet, so that there will be a dramatical reduction in this situation. And at the same time, there is a long-term situation is, the only solution is the mandatory rainwater harvesting, not only in Delhi, but in all the states. Because when the water level increases, it will improve the soil moisture, it will improve the health of the vegetation. So whatever our problems, that is actually imbibed due to our wrong practices. And it is doable, short term as well as long term.
You know, I just want to ask any one of you who could tell me, are we underestimating indoor pollution? You know, we think that if we are going to be seated indoors and turn the air freshener on.
No, see that there is a problem that everyone is now going to buy the air purifier. But can you think that only 1% of the population can afford to buy the air purifier? All cannot. So in the government offices, you will find the air purifier. The people who are marginally above the poverty level, they also can afford somehow. But what about those people who cannot buy air purifier? We have to think about them. Then automatically the problem will be solved. You see, air purifier is not the solution. Indoor, you have to seal. But how many people can afford to seal the whole house? If they are living in a one-room apartment or two-room apartment, how it is possible to seal the whole house?
Moreover, it is not only the money, but how
a final word, if I can. Correct. I agree with you, sir. A final word, as I'm short on time here. I asked Mr. Sanjeev Bagai, Doctor, the boy who had to get his tonsillitis removed, is it a one-off case, or are we seeing more cases of children coming with terrible breathing difficulty? And a little more on the parents who are now blaming Delhi's pollution. Do you believe they can even sue the government? If at all that's the case, can they really connect pollution with tonsillitis being removed entirely? A little clarity from you on that, and about indoor pollution as well, please.
Yeah, so indoor air pollution is well known. It's very often not spoken of. It's a host of factors which include the environmental relative humidity, the contents in the house, the open windows and doors which normally people tend to keep. Air purifier helps, but only transiently and for a limited given space in one room. With regards the publications internationally and with Indian data, there is a direct link between all body organs, including the throat and the tonsils, with air pollution. With regards anyone suing the government, I'm not a legal expert, but if India with this government can come over and overcome the catastrophic pandemic, I'm absolutely sure that this government can tackle air pollution. We need a strong will, we need an iron hand to implement, and we need a robust, at least 4 to 5 year plan. It is not going to happen overnight. This pollution is not going to disappear in a year. We need a comprehensive roadmap with deliverable targets to be monitored every quarter and make it public so that the people know where we are. We know that this is going to cause long-term damage. I've mentioned about cancers, respiratory, cardiac, neurological damage, dementias, Alzheimer's, Parkinsonism, kidney cancers, liver cancers. So we need to take an action and action now.
You know, a final word, if I can ask you on any 3 quick measures we can take if we are living in this furnace, what can we do without a choice?
I think most important is to control road dust, including the construction norms being implemented strictly. Point number 2, we need much better control of the traffic. The vehicular emissions with vendors on each side with double and triple parking is going to cause stagnation of the cars, and that's why more emission in a given small area. Point number 3, all farm fires have to stop. This is a complete ridiculous mockery which we made of our health. And lastly, most importantly, all polluting units, which is especially the hydroelectric powers or the coal powers, have to move out of Delhi to give Delhi some breather. Article 21, we need air, we must live.
Absolutely. Very well said. Thank you very much. I really appreciate Dr. Sanjeev Bagai, Dr. Gurfan Beg and Professor Soumitra Mukherjee for joining us on this much needed issue. It's a health emergency. We're really hoping the agencies wake up. On that note, we're slipping into a very short break. We'll be right back on World HIV Day. We have some hard numbers. It's coming to 4, especially in Karnataka, and certain groups HIV numbers have increased, and the reason to why there's a worry is because World HIV Aid funds has been slowed down. Hardly funds coming in, and that's leading to a risk of these numbers growing. Stay with us.
Eastern India's first Business and Economy Literature Fest 2025 on 20th and 21st December at Taj Tal Kutir, Kolkata. EIILM Kolkata presents a Business and Economy Literature Fest 2025. Curation and ideation partner Story Nest.
यही मौका है बिजनेस को बढ़ाने का, पर पैसा
अपनी सुपर पावर यूज करने का टाइम आ गया है।
टेंशन मत लीजिए, IIFL फाइनेंस से झटपट गोल्ड लोन लीजिए और बिजनेस आगे बढ़ाइए।
आपके जैसे सुपर हीरोज ऐसी छोटी मोटी प्रॉब्लम से थोड़ी ना रुकते हैं, इसीलिए लाइफ जब भी आगे बढ़ने का मौका दे तो अपनी सुपर पावर, अपना गोल्ड यूज करिए और IIFL फाइनेंस से गोल्ड लोन लीजिए। IIFL फाइनेंस करता है सीधी बात।
आराम से हाँ। सामान देना भैया।
अब आगे क्या करना है? वो बिट्टू की पर्ची में देखो ना, कहाँ गई पर्ची?
नमस्ते
जी।
हाँ, मुझे पता है वो पर्ची में क्या लिखा होता है। आप चलिए मेरे साथ। व्हीलचेयर, ये आपका और ये आपका। पर्ची में शॉपिंग की बात तो जरूर लिखी होती है। थोड़ी पेट पूजा की बात कोई पर्ची में ना लिखे, ऐसा हो सकता है? टिफिन लाया।
थैंक यू।
अरे पर्ची मिल गई।
पर्ची में तो ये सब लिखा ही नहीं था।
हम है ना आपकी पर्ची।
सिर्फ वर्ल्ड क्लास एयरपोर्ट्स नहीं चलाते हैं, आपके सफर में हम सफर बन जाते हैं। अदानी, हम करके दिखाते हैं।
breaking news. Major disruption is expected this week.
Yes, disruption confirmed. That's me. Relax, no scams, just my brand new show, News Gossip with Cyrus.
Welcome back. Let me take you through a big story. Today is World AIDS Day, and new data that's coming in, especially from Karnataka, gives us a mixed picture on HIV. Among the general population, including routine testing for pregnant women, HIV positivity has gone down, thankfully. That means awareness and screening is working, but among key high-risk groups, the situation at this point seems to be worrying. Across 6 groups, the situation has worsened, and that's female sex workers. Among MSM groups, that's men who have sex with men, gays as we call them, transgender and hijra communities, injecting drug users, migrants and transport workers. This is a high-risk group where the numbers of HIV has gone up. Now, I'm talking about Karnataka limited to. Karnataka carried out over 17.6 lakh tests in recent years, and HIV positives have climbed every year. So to give you some figures, in 2020, HIV cases in Karnataka was 182 among these high-risk groups. And then in 2021-22, it was 243. 22-23, it was 336. Then in 2023-24, it was 564. And 24-25, it's jumped to 828. Again, only in this high-risk group. The rise of nearly 60% in 1 year alone. Transgender and hijra groups have the highest positivity percentage, meaning a large share of those who are tested among this group are showing positive. Even though fewer people are tested in these communities though. MSM, that's men who have sex with men, have consistently recorded the highest number of HIV positives. In 2024-25, female sex workers briefly overtook MSM group, raising concerns about new transmission pockets. Injecting drug users, migrant laborers and transport workers are showing lower positivity, but with fluctuations that health officials are currently very closely tracking. So the epidemic here is shifting. The general population by and large is safer. Numbers have come down in this general population, but these risk groups are becoming more concentrated in specific, risk is becoming more concentrated in specific communities. Experts say a key reason to reduced HIV though is basically experts are suggesting the key reason to this rise within the high-risk groups is lower funding of HIV aid worldwide. Some clinics have cut services as well. Outreach has also slowed down, and this could really lead to thousands of preventable infections in the coming years. So the blame, of course, is in the larger aid that was coming earlier from world groups and organizations and NGOs to clinics all over the world to ensure HIV is addressed. But at this point, that seemed to have terribly slowed down. HIV has not gone away. Targeted prevention must return to the front line. HIV aid at this point is primary. We wonder why it slowed down. Let me bring our panelists on board to give us a little more insights into why this rise in certain groups, particularly Karnataka numbers we played out for you. We have joining us Shyam Konur, who's a founder and CEO, Mist LGBTQ Foundation. Thanks, Shyam, for joining us. He's from Bengaluru himself. We also have Dr. Ishwar Gilada, who's a consultant doctor, infectious diseases, and Secretary General People's Health Organization. Thanks both of you for joining us. Shyam Konur, do you want to give us a little sense of the risk of HIV among LGBTQ groups? Largely in Karnataka, the reports have come, seem to be alarmingly high. Give us a sense of what your study is as per your foundation. What have you found?
So we also work on HIV testing, mostly I would say self-testing. We were supported by these organizations that you were speaking about globally too. And to what you say, I would say not just for testing, but to create awareness, to encourage communities. So it's easy for a community member to reach out to us as a community organization because they trust us. So because of the fund cut, there are a lot of organizations have to shut down or cut down on their staff, on creating awareness efforts have been gone down. If people who can afford can go to a private clinic, but we see that there are things like Aadhaar card requirement for doing a HIV test. So there are these kind of things people hesitate to go and regularly have their HIV tests, or they're scared to talk about that they need help with the HIV testing, or, for example, like you said, drug user community. So the drug user communities and many other people are scared to come to us or take help. So that's one of the major things, I think, in the terms of the rise. I know that because of the fund cut, our global target that we had to end HIV by 2030 will slow down for sure. I remember that when we went to the World AIDS Conference last year, which was in Germany, there was a improvement. Like, we were going to get PrEP, which is like 6 months once injectable PrEP. Now I feel that will also slow down, or that will also be delayed in coming to India. That's the feeling that I have with what's happening with the current funding situation. Yeah.
Okay, that's interesting. Dr. Ishwar Kilada, Doctor, we're looking at Karnataka data showing some alarming numbers within the MSM groups. That's men who have sex with men, transgender and Hijra communities. Why do you think so? This was always a high-risk group. Could you give us a little more? Funding has been cut to ensure awareness, and many still see HIV as no longer a threat. Also, at the same time, the numbers have reduced in the general population, but these high-risk groups still to be seen as high risk. Why do you think?
Thank you very much, Nabila, for having me on the show. And this is a great day, which started almost 40 years before, and now we observe this as a World AIDS Day. Let me tell you frankly one thing, that India's National AIDS Control Organization and Program is one of the most lauded program globally. And it is 100% funded by us, by our own funds. And that's the reason that despite funding cuts globally, it did not collapse. The program is going on. Yes, there are maybe 5% of the intervention projects which are supported by international organizations, particularly from US, where the funding cut has been there. Organizations have been completely closed down, like USAID. UNAIDS is likely to be closed down next year. Now the issue is, I sense almost 5 or 7 years before that HIV is increasing, and nobody believed me, because when HIV awareness started in 85, 86, and thankfully it was started by me in 85. First AIDS clinic in the country was started in 86. From then, it took almost 10 to 15 years time to have a national scenario where everything was kind of built up. And then HIV started going down because condom awareness campaign was very powerful. Not only HIV, all other sexually transmitted infection went down. In 2004 and 5, when the government of India started ART program, antiretroviral therapy, then the entire prevention program took a backseat. So if you look at the national budget, almost 98-99% is going for treatment and care and support, and hardly 1 to 2% goes for prevention. So prevention campaigns are poor. Intervention campaigns among the high-risk behavior communities, sex worker, LGBTQ community, they are poor, they are not supported. And we thought that everything is going on well. But what has happened in last 10 years, that STDs have started rising again. Why? There are a couple of reasons. Number one, the section 377 is repealed, and we thought that something will be properly done. But people were already, the LGBTQ community was there for long back. So only act is repealed or mindset is not repealed. Or mindset is still discriminatory, creating stigma, don't have an enabling atmosphere for them to come to clinics. And therefore they do not come. At the same time, when they don't come to the clinic, you go to them, and one of the way can be a mobile clinic, etc. But HIV self-test. HIV self-test has been a kind of backbone of finding out the last milestone. And for last 9 years, 10 years, it has been happening in smaller countries, but not in India. It is not part of the national program. Secondly, we do not give pre-exposure prophylaxis. So what our government does, that you get HIV and you come to us, I'll treat you free of charge for whole life. But I will not give you tools to prevent HIV. I will not give you pre-exposure prophylaxis. So this is a dichotomy. Sham just now said that there will be injection which is going to come once in 6 months you take and you prevent HIV almost 100%. Now India will make that injection, make available for 115 countries in the world, but India cannot use it. Again, because there's a dichotomy with the Drug Control General of India.
Correct.
They say that to use in India, you do Indian trial. To do an Indian trial for any company, they need to spend 5 to 10 crore rupees. Who will spend? From the money, where the money will come? So when there are a multi-centric trial which establishes globally that this product is working, Government of India allowing them to produce in India, sell to all over the world, but not to be used in India. Again, this is dichotomy. So I think there is some policy paralysis and there need to be some kind of valid discussion. And that's the reason we should be able to come together on such kind of day like World AIDS Day. And last but not the least, the communities which are badly affected, they need to be taken into confidence. They need to be taken as a human being, not they, not we, all of us, amongst us. I have been the person.
I know. So stigma should. No, but we are living in much better times. Don't you agree, Doctor? We are living in much better times. That stigma was there at one point. I think people are now more educated, more exposed and learned and understand. So stigma is in that sense slightly, toned down. I surely would say that. But at the same time, you believe that they're not coming out, they're not taking early treatment. That's your assessment. That high-risk groups like gays, like transgenders, Hijra communities are not coming forward to actually take timely treatment.
No, stigma has not come down. It has been reduced. Stigma is still there in minds of people and more stigma in those people which are highly qualified, highly educated. I'm sorry to say that even in our own community, medical community, there is high stigma amongst surgeons, among gynecologists. So whenever they treat HIV positive person, they will say, that person should be last on the list for surgery. We will fumigate the theatre. So that stigma has to go away. But here the stigma related to LGBTQ community is that legally now they are accepted, but socially they are not well accepted. And unless and until there is an enabling atmosphere, we don't give a bad look to them, we don't ill-treat them, we treat them with honor and dignity, they will not come forward. So you need to have a LGBTQ friendly atmosphere. And that atmosphere is hardly at 10 to 15% of medical care centers, not 100% everywhere. So that's the reason that they will not come. Even if they don't come, if you can do pregnancy test at home, COVID test at home, sugar at home, why can't you do HIV test at home? Why that is not part of the program? So you can buy HIV self-test on Amazon, but it is not part of the program. So it has to be part of the program to make it acceptable to most people.
Doctor, but a quick one, if you can educate us. If you can educate us in a nutshell, how does one contract HIV?
97 to 98% contraction currently is sexual. And sexual can be male sex with male, bisexual, heterosexual. Other 2% is from injection drug use. It can be accidentally from blood transfusion because everywhere blood is screened, but they can be in window period, and mother to child transmission. So all these three they constitute only 3 to 4%, not more than 3%, 4%. 96 to 97% is
so, Doctor, would you say that protected sex is the only preventive, the best baseline prevention? Protected sex is the best baseline prevention?
Very good question, and the best answer is protection has to be barrier protection like condom. Today what has happened after pre-exposure prophylaxis and post-exposure prophylaxis awareness, the condom has taken a back seat. So you can prevent HIV by taking PEP or PrEP, but you get other STDs and all other STDs are going up. You take syphilis, you take herpes, you take gonorrhea, chlamydia, you take HPV, they are all increasing and they will outnumber HIV in no point of time. HPV and hepatitis B, they are very common and they are both vaccine preventable. Hepatitis B vaccine is a peanut cost. In 100 rupees you can get 3 doses. It is not done. HPV is expensive, but we talk about only preventing women because of cervical cancer, but men also get penile cancer and anal cancer.
Correct.
So we need to focus on all STD, and for that prevention you need condom.
Right. Right. All right, Doctor. Thank you very much. A final word I'll take from Sham. Sham, if we're looking at a high risk group at this point, largely people belonging to the LGBTQ, a quick take, your message as part of your foundation or your reassurance on what kind of community building are you all doing at this point? What kind of safeguards are you all ensuring? How you all sensitizing people within the community to ensure that they are safe?
So I would say that we regularly try and, like Doctor said, pre-exposure prophylaxis is what we also promote in our organization, in NGO. We subsidize the prices for them. We subsidize the rates so much that it can be affordable for people. We also give PrEP for free if a trans person is interested, and they are regularly ready to come and take advice from us or check their medical history. We have doctors who keep a check on them. So we also advise them to take it for free from us if they are unable to afford it. These are some things we do. We try also educating people that PrEP is not the only solution. You need to practice safe sex practices. So we also distribute free condoms. These are some of the programs that we do. We encourage people to come talk about what they feel. We encourage them to be comfortable. So we have a helpline where people can call and speak anything that they want. So that way we try and make them feel comfortable to come and access services through us. We also work, luckily in India, because of all the ART centers, the government does support with treatment. Many other countries, these support are not there after the fund cut. They are struggling with this. So I'm glad that in India, the government at least supports with the treatment. But they need to also, increase the prevention.
Yeah. Surely, yeah. Thank you very much. More power to you, Sham, and your organization do great work, and Dr. Ishwar for enlightening us on this. Thank you. All right, let's quickly cut across to our top stories on day tonight. If I could take you through our parliament today that began, the winter session of the parliament began with much chaos. The winter session began and immediately collapsed into confrontation. Opposition MPs rushed into the well, demanding a discussion on the ongoing voter roll revision. Slogans drowned out proceedings. No business could continue. The Lok Sabha was adjourned on day one itself. Before the session, Prime Minister Modi had accused the opposition of all the drama, saying we want to make discussions, we want to have fair discussions, but the opposition pulling off drama inside the parliament, this is not going to get any results, only disruption. Congress retaliated within minutes. Priyanka Gandhi Vadra said holding the government accountable is Parliament's job. So asking question does not mean we are creating ruckus. In fact, Mallikarjun Kharge, on the other hand, accused the Prime Minister of performing theatrics while ignoring economic stress, unemployment and price rise. According to him, real issues that are being ignored. There was also a moment that stirred fresh controversy. Congress MP Renuka Chowdhury walked into the parliament carrying a rescued puppy in her car. When asked questions, she said that, well, this is a dog who's gentle. The real ones who bite are sitting inside the parliament. Well, the BJP also called this a stunt, but it was something that grabbed eyeballs on the first day of the winter session in the parliament. The message from the first day is, of course, quite clear. The session is off to a bitter start. Voter roll issue, of course, at this point is looking at the heart of discussions in the days going forward. Let's hear it, some of the reactions that came in.
ड्रामा करने के लिए जगह बहुत होती है, जिसको करना है करते रहें. यहाँ ड्रामा नहीं, डिलीवरी होनी चाहिए. नारे के लिए भी जितने नारे बुलवाने हैं वो पूरा देश खाली पड़ा है. जहां पराजित होकर के आए वहां बोल चुके हो, जहां अभी पराजय के लिए जाने वाले हो वहां भी बोल दीजिए. लेकिन यहां तो नारे नहीं, नीति पर बल देना चाहिए और वो आपकी नीयत होनी चाहिए. साथियों, हो सकता है राजनीति में नेगेटिविटी कुछ काम आती होगी, लेकिन अल्टीमेटली नेशन बिल्डिंग के लिए कुछ सकारात्मक सोच भी होनी चाहिए.
It's not drama. Speaking about issues, raising issues is not drama. Drama is not allowing discussion. Drama is not having a democratic discussion about issues that matter to the public.
जानवर को पसंद नहीं करते है ना सरकार. गूंगा जानवर गाड़ी में चले गए तो इनको क्या तकलीफ है? काटने वाला कुत्ता दिखा क्या? इतनी सी तो है, काटने वाले और है पार्लियामेंट में, कुत्ते नहीं।
सिक्योरिटी कंसर्न
कौन सी सिक्योरिटी कंसर्न है?
उसका भी पास बनता है क्या?
अच्छा बना दो, बाकी तो हम क्या बोले।
All right. Here's the government now confirming that there was indeed a security breach in Delhi airport. The government has confirmed repeated GPS spoofing attacks near Delhi airport, one of India's most critical airspaces. This is not a technical glitch. Spoofing, remember, sends fake satellite signals to track aircraft into believing some false coordinates, a direct aviation threat. Such interferences are now also been reported in Kolkata, Mumbai, Hyderabad, Bengaluru, Chennai and Amritsar as well. A major incident, remember, that happened on November 7th where several flights were cancelled or diverted. The systems itself shut down. According to officials now, it indeed could have been GPS spoofing. The runway upgrade and an ATC malfunction had forced pilots at that point to rely solely on GPS, and the GPS signals were compromised at that exact moment. India says it has backup ground-based systems to keep flights safe. But the threat is quite clear. Aviation sabotage is happening from the ground, aimed at the skies, and clearly we are still figuring out who's responsible. All right, let me take you through a quick look at Kerala Chief Minister who's currently in the dock. ED has targeted Kerala government over masala bonds. A major financial investigation has reached Kerala's top political leadership. The Enforcement Directorate has issued a show-cause notice to Chief Minister Pinarayi Vijayan, ex-Finance Minister Thomas Isaac and CM Secretary alleging FEMA violations in Kerala's masala bond issue. Kerala had raised 2,150 crore overseas in 2019 from infrastructure. 2,150 crores money that they had raised through overseas, basically according to the ED, they say that parts of this transaction worth nearly 468 crores breached foreign exchange norms, and many involved diversion of funds as well. The opposition, of course, in Kerala argues borrowers are now trapped because 9.73% interest means nearly half of what Kerala raised is now going only into paying interest. Thomas Isaac calls the probe politically motivated and repeated before every election. Now, the state says RBI approvals were in place. High stakes test of financial governance begins at this point with the Chief Minister himself in Kerala under scrutiny. A story that's coming in from Kerala. Right-wing activist and TV commentator Rahul Ishwar has been sent to 14 days of judicial custody. His bail plea was rejected today by the Trivandrum Additional Sessions Court in the cyber abuse case linked to the Rahul Mamkuttathil sexual assault investigation. Ishwar is accused of repeatedly targeting and insulting the survivor by publicly revealing her identity across TV debates and social media after she filed a complaint against Congress leader Rahul Mamkuttathil. With the court now rejecting bail and sending him to judicial custody, the case now moves into its next phase as investigators continue examining Ishwar's online conduct and its impact on the survivor. Though Rahul Ishwar himself calls this arrest as politically motivated. Listen in.
This is freedom struggle for men, and this is against the Arnesh Kumar verdict, and they have not been served any notice. Police is claiming that they have served me notice. They have not served me any notice. So please remember, this is blatant disregard of Supreme Court verdict. It is Supreme Court the Vidhi Nyayangalude Langhanamanu.
Yeah. All right, chaos outside the Election Commission office in Kolkata over SIR. Booth-level officers, the people handling India's voter roll, are all refusing to continue under what they call unmanageable workload in the special intensive revision exercise. They're demanding 2 more months to complete voter verification. The Election Commission has rebuked the Bengal government for not paying BLOs increased compensation already approved for the revision exercise. That's 12,000 annual honorarium and 6,000 additional support. TMC counters it, saying the centre has blocked 2,000 crores of state funds and claims that it is ready to pay BLOs even up to 50,000 rupees once the dues are released. The fight over voter lists has escalated into a battle of centre versus state now, with frontline election workers caught in the middle. quick look at the BLO suicide case. A 46-year-old BLO in Moradabad, Sarvesh Singh, died by suicide, blaming unbearable pressure from SIR duties. His note says that he was unable to meet impossible deadlines. A video shows him crying, saying he was trying his best. He leaves behind a wife and 4 daughters. This is a direct warning that the system responsible for maintaining India's electoral integrity may be pushing its own workers past the breaking point. No political blame game can really hide the truth here. Voter list division has turned into a human crisis as well. Thanks very much for tuning in. Do have a great night.
सोच रहा हूँ टर्म लाइफ इंश्योरेंस ले लूं ताकि मेरे बाद फैमिली को पैसों की कमी ना हो। तू भी ले ले।
अबे जल्दी क्या है, बाद में देख लेंगे।
आराम से अपने कुणाल को हार्ट अटैक आ गया यार।
पॉलिसी बाजार पर 0 GST के साथ अब 1 करोड़ का टर्म लाइफ इंश्योरेंस सिर्फ 400 रुपए महीने से शुरू।
ये बेस्ट है मैम।
पर पहले वाला क्यों नहीं?
अजय भाई, This one's for you. बिरला ओपस इंश्योरेंस देने के लिए।
ऐसा क्या है इसमें?
एडवांस क्वालिटी। 1 साल में पेंट को कुछ भी हुआ तो पेंटिंग वापस करके देंगे।
वापस करके देंगे।
वो भी फ्री।
पटेल भाई, you're a rock star.
क्वालिटी पे इतना कॉन्फिडेंस, इसलिए बिरला ओपस इंश्योरेंस रजिस्टर करो birlaopus.com पर।
Eastern India's first Business and Economy Literature Fest 2025 on 20th and 21st December at Taj Tal Kutir, Kolkata. EIILM Kolkata presents a Business and Economy Literature Fest 2025. Curation and ideation partner Story Nest.
This is India's #1 news network, and you're watching News 9, English news as it should be.
Government tells the parliament that 15 people, including Vijay Mallya and Nirav Modi, declared fugitive economic offenders owing over 58,000 crore rupees to banks, 9 of them linked to major frauds against public sector banks. Civil Aviation Minister confirms GPF spoofing attempt near Delhi Airport. Several flights reported navigation interference on runway 10. 7 airports affected in all. Centre directs smartphone makers to preload government Sanchar Sathi cyber safety app on all new devices within 90 days and ensure that it cannot be uninstalled as part of efforts to curb phone fraud. CBI arrests absconder Shafat Ahmed Shanglu, wanted for 35 years in connection with the 1989 Rubaiya Saeed kidnapping case. Activist Rahul Ishwar sent to 14-day judicial custody in a case related to the online defamation of a woman complainant in a sexual assault case involving suspended Congress MLA Rahul Mamkutathil. Amidst leadership friction in Karnataka, DK Shivakumar invites Chief Minister Siddaramaiah for round 2 of breakfast talks tomorrow at his residence. Says the Chief Minister and him continue to work together as a team. PM Modi speaks to Sri Lanka's President Anura Kumara Dissanayake, expresses condolences over death and devastation caused by Cyclone Ditwa, says India stands ready to extend all possible support. India's External Affairs Minister Dr. S. Jaishankar meets Thailand's Foreign Affairs Minister at Hyderabad House in the capital for bilateral discussions.